Good afternoon all. We may discuss regarding the topics in relation to the neurological system, and we are continuing with the CVA or stroke. Just before that, we are briefing the circulation of the brain or the cerebral circulation. So mainly, you know that the circular villus is the main point in the arterial circulation of the brain, and there are different branches that including the right middle cerebral artery, then posterior cerebral artery, external carotid arteries, vertebral arteries, common carotid arteries, and the anterior cerebral artery, left middle cerebral artery, anterior communicating artery, then posterior communicating artery, then basilar artery, and internal carotid arteries. And the different functional areas of the brain. You know that there are different areas like the motor area, the sensory area, frontal lobe, Broca's area, temporal lobe, brainstem, parietal lobe, occipital lobe, Wernicke's area, and the cerebellum. The motor area is controlling the voluntary muscles. It's control of the voluntary muscles. The function of the motor area for the control of the voluntary muscles. Then the sensory area, from the term itself, the sensation, that is the skin sensation, temperature, pressure, and the pain. In the frontal lobe for the movement, problem solving, concentrating, thinking, behavior, personality and mood, and the Broca's area for speech control, and the temporal lobe, hearing, language and the memory, and the brainstem, that's the consciousness, breathing and the heart rate, and the parietal lobe, that is sensation, language, perception, body awareness and attention. Then the occipital lobe for vision and the perception, and the Wernicke's area, that is language and the comprehension, and the cerebellum for posture, balance, coordination of the movements. These are the different functional areas of the brain and the particular functions in brain. Hope you all remembering the brain anatomy and the main physiological things. And we move to the topic, that is stroke or CVA. CVA means cerebrovascular accident. The definition of the stroke by World Health Organization in 1971 is a focal neurological deficit due to a local disturbances in blood supply to the brain, and its onset is usually abrupt and but may extend over a few hours or longer. Means once there is a block in the brain, that may self-destruction will be there. Means the autonomic regulation will be there, and which will be helping to reduce or will be removing the thrombi, or automatic thrombolysis will be there in our body, and the in such a minor case the thrombi will not be producing any severe symptoms, and it will be remaining or it will recover easily. That's the thing. So the definition is it's a focal neurological deficit due to a local disturbances in the blood supply to the brain, and its onset is usually abrupt and but may extend over a few hours or longer. That's the definition of CVA. Then coming to the incidence. According to WHO, the 15 million people suffer stroke worldwide each year. Of these, 5 million die and another 5 million are permanently disabled. Hope you know the main symptoms of a stroke. Means there will be paralysis and all. So the of the total 15 million people are getting suffering with the stroke, 5 million die and the another 5 million are permanently disabled. And the high blood pressure contributes to more than 12.7 million strokes worldwide. And in developed countries, the incidence of stroke is declining, and largely due to the efforts to lower the blood pressure and reduce smoking. And however, the overall rate of stroke remains high due to the aging of the population. And the stroke is a frequent cause of death also. And the incidence increase with age, mainly people between the age of 40 to 60 years, they are getting more affected. Why? Because they are at the higher risk because of the aging, as well as they will be high risk for developing the stroke. Means because of high blood pressure and the diabetes mellitus. And the brain infarction or the stroke occurs 30% more frequently in men than in the woman. its more frequency is men than comparing to the women. As you know, the bad habits like the smoking and alcoholism, all those things will be higher in the man comparing to the woman, and because of that, the infection risk will be higher among the men than the women. I'm not saying that the women are not free of the bad habits, but comparatively the rate is more among the men, and because of that, there will be increased risk for developing the stroke. And coming to the etiological factors, mainly the etiological factors are the atherosclerotic causes, that means the direct thrombi formation within the brain. That is the atherosclerotic causes. And the small penetrating artery thrombus means there will be small thrombi formation in the small arteries, and which will be dislodged from the small arteries to the cerebral circulation, and by that further results in the thrombi in the brain. That is the uh, how the small penetrating artery thrombus leads to a brain attack. And the cardiogenic or the embolic causes. The cardiogenic causes means in case of a MI means myocardial infarction, there will be thrombi formation in the cardiac circulation or that the coronary circulation. That thrombi may dissolve from the particular site, and that may means locked in the uh, cerebral arteries, and that further results in the uh, brain attack or CVA. That is the cardiogenic or the embolic causes. And there may be due to the idiopathic causes. That means unknown causes may be leading to the development of the CVA or stroke. These are the main etiological factors in relation to the stroke. Then coming to the risk factors. Once we are discussing about the risk factors, there will be modifiable and the non-modifiable risk factors. And the non-modifiable risk factors include age, gender, race, and the family history or the heredity. As you all know, age means once the age is advancing, then there will be high risk for developing the stroke. And when coming to the gender, in men's, when we are comparing the men and females, the men will be having more risk for developing the stroke than the females. Then coming to the race means the racial difference will be there, and the those who are in the United States, all those people will be having higher risk for developing the stroke comparing to the other region. And the family history means once there is a family history of stroke. As you all know, the particular cases like hypertension, diabetes, all those things will be getting hereditary getting affected, and those people with the high risk will be having the higher family history will be having the more risk comparing to the others with the non history of stroke or other diseases. Then coming to the modifiable risk factors. The modifiable risk factors are mainly the lifestyle. The lifestyle means the changing lifestyle and the increased risk, intake of the canned foods and all. The habits including and the habits just like the alcohol consumption, then cigarette smoking, then obesity, then diet which is high in the fat content. So these are all the things which will be increasing the risk, and once there is a in initiative from the patient side, then the risk will be getting reduced. That's why these are the modifiable risk factors. Then the drug abuse also will be increasing the risk of stroke. Then the cardiac diseases. As you all know, we already discussed that the cardiac diseases will be further resulting in the brain attack. So once we are reducing the cardiac diseases, once we are treating or getting the regular treatment for the particular case, then the risk for developing the further disease will be getting reduced. Then the diabetic mellitus, then hypertension, then migraine, headache, then hypercoagulability states, and polycythemia and sickle cell anemia. All those things are the medical conditions, and once we are getting the correct treatment, then the risk will be getting reduced. That is why these are known as the modifiable risk factors. Then coming to the classification of stroke. There are different classifications for stroke. One is the Bomford or the Oxford classification, and the other one is based on the cause, that is whether the ischemic or hemorrhagic cause. So we can discuss in detail. That is, one is the Bamford or the Oxford classification. There are mainly divided into four. That is the TACS, that is total anterior circulation stroke. Then the PACS, that is partial anterior circulation stroke. Then LACS, that is lacunar anterior circulation stroke. Then POCS, that is posterior circulation stroke. These are the different classification under the Bamford classification, that is TACS, PACS, LACS and the POCS, that is total anterior circulation stroke, partial anterior circulation block, then lacunar anterior circulation stroke, then POCS is posterior circulation stroke, and I can deal one by one. The TACS or the total anterior circulation stroke, that is a combination of a new higher cerebral dysfunction, and there will be homonymous visual field defects, then motor or sensory deficit or face, arm or leg. Then PACS is partial anterior circulation block, that is 2 or 3 of the total anterior circulation stroke will be there, and new higher cerebral dysfunction alone will be there. Motor or sensory deficit more restricted than the LACS. Then the LACS or the lacunar anterior circulation, that is pure motor. Means there will be unilateral weakness of face, arm or legs, and the pure sensory, that is unilateral sensory disturbances will be there, and the sensory motor type of stroke and ataxic hemiparesis will be there. And the POCS means the posterior circulation stroke, and in that there will be cerebellar dysfunction, then brainstem signs, then occipital lobe dysfunction, then bilateral weakness or sensory dysfunction, and the ipsilateral cranial nerve palsy with contralateral weakness. Then next one is the classification based on the cause, that is the ischemic and the hemorrhagic stroke. The ischemic stroke means the thrombus formation, and there will be death of the brain cells, and the hemorrhagic means due to the bleeding there will be stroke formation, and further that will be resulting in the CVA. And the ischemic stroke means there will be thrombosis, that is in situ obstruction of an airway will be there, and that in turn will resulting in the thrombosis formation. And the embolism means particles of debris originating elsewhere that block the arterial access to a particular brain region will be getting embolized, and that may result in the ischemic stroke. And the systemic hypoperfusion, that is more general circulatory problem manifesting itself in the brain and perhaps other organs may become or leading to the ischemic type of stroke. And the hemorrhagic stroke means that is intracerebral or the subarachnoid hemorrhage. Hemorrhage means bleeding, and further there will be resulting in the death of the brain cells. That is the hemorrhagic stroke. Then coming to the pathogenesis of the ischemic stroke. There are several mechanisms by which the ischemic stroke can occur. Among them, one is listed here, that is the atherosclerosis, that disrupts the blood supply by narrowing the lumen of the blood vessel generally. Atherosclerosis means there will be a clot formation in the thrombi, and that will narrowing the pathway, or the arterial circulation will be getting narrowed, and that may result in the embolic infarction, and it enters into the cerebral circulation and blocks the blood vessels. As a result, the brain don't get enough energy as the oxygen can reach the brain, and hence body switches to the anaerobic respiration. As a result, there will be lactic acid will be produced. Finally, that will be resulting in the lactic acid potentially destroy the cells, which since it is an acid and disrupts the normal acid-base balance in the brain and causes the death of the brain cells. That is what is happening in the ischemic stroke. Once there is a atherosclerosis, that will be disrupting the blood supply by narrowing the lumen of the blood generally, and embolic infarction, and it enters into the cerebral circulation and blocks the blood vessels, and the brain don't get enough energy as the oxygen can reach there, and there will be hence the body switches to the anaerobic respiration, and there will be production of the lactic acid due to the anaerobic respiration. Finally, the lactic acid potentially destroys the cells, and since it is an acid and disrupts the normal acid-base balance in the brain and causes the death of the brain cells. This is what is happening in the case of a